I want to take you live now to the port city of Durban. It's the day 2 of the 9th South African AIDS Conference currently underway in the port city. HIV/AIDS activists, scientists and guest speakers are deliberating on ways to help curb the spread of HIV using technology. Now, various groups will also give feedback on a number of achievements and the progress South Africa has made since 2010 in curbing the virus and ensuring easy access to treatment. Our reporter Vusi Khumalo is there and he joins us now live. Hey Vusi, thank you very much indeed for your time. What can we expect today? And maybe if you can just recap of what happened yesterday.
Yes, Ben, welcome back once more at the Durban ICC, where the 9th AIDS conference is taking place here. It's a 4-day conference that got underway from yesterday. It will end on Friday. Well, there are a number of issues that were spoken about here, including that of the people living with HIV. Saying that some of them are still being stigmatized. That's one of the main key issues being discussed here. As we know, that worldwide there are about 30 million people who are HIV positive, and especially KwaZulu-Natal. And as you know, that South Africa has got about 7.3 million people who are who are estimated to be HIV positive, and also the the province of KwaZulu-Natal is regarded as the epicenter of HIV people. We have about, out of that, 1.3 million people who are HIV positive. And on top of that, we know a number of interventions that have been made by government, apart from the awareness or raising awareness, campaigns by government. There's also this program being partnered by the King of Amazulu, Zeltini, as well as the Premier of KwaZulu-Natal, as well as the Health Department doing a medical male circumcision. Well, there are a number of role players and stakeholders when it comes to HIV-related matters. With me is one of them, Mr. Robinson, who is here coming all the way from Northwest, who is a public health practitioner or specialist. Tell us about some of the work that you do in the Northwest when it comes to HIV field.
Thank you, Vusi. In the Northwest province, the Northwest University is assisting the province in rolling out the community health worker program, and that is by training the community health workers to use mobile health devices so that the foundation of the healthcare system is strong. And it's really important to get the community-based and the district health system as a foundation for the national health insurance. And with that, if we have that strong foundation, the national health insurance can be a reality, something that we're all hoping for.
Okay, in layman's terms, we know that now we are living in a fourth industrial revolution. Take us through, or just explain to us about this year's theme of unprecedented innovations and technologies, HIV and change.
Thanks, Vusi. I'm the chair of the clinical track that's looking at biomedical innovations, and that's really important in combating the HIV epidemic, because where do the tablets come from that people have to swallow? You can't keep on taking the same tablets because the virus keeps on changing, and therefore the tablets that people take need to follow that change. One hears of people being resistant to the HIV on certain tablets, and part of the conference presentations are dealing with new, different tablets. That's the one aspect. The other big aspect is on HIV preventative vaccines, and there's a whole tracking the vaccines, which we still haven't got. We've still got a number of years to go, but it's really important to develop that technology. And the third thing is, as people with HIV on treatment can live as long as anyone, they can live. In fact, I think people with HIV live longer than other people because they're getting more care. And because of that, they will get chronic diseases like other people. They'll get TB, they'll get cardiac disease, they'll get hypertension, all the chronic diseases. So it's really important that those illnesses with the combined HIV infection are managed properly. Otherwise, those chronic diseases will kill people before the HIV. So In fact, more people die from non-communicable chronic diseases than HIV. So it's really important to make sure that those are prevented and managed as best as possible. Also, the terrible twin of TB and HIV, that really needs to be managed and treated. And we've got major problems in South Africa. You've said we are the epicenter of the epidemic. And the science that has emerged from the clinicians and the researchers in KwaZulu-Natal in particular, and the rest of the country, have really contributed to global knowledge of the epidemic.
Okay, you are also charged with the responsibility of providing primary healthcare in Northwest communities. Tell us about that program. How is it going?
Right, I used to be in the Department of Health, and I'm now joined the Northwest University, and we're trying to ensure that the community health worker program is really successful and feeds into the public health system through the clinics and seamlessly right up to the big hospitals. And community health workers enter homes, they know the basic health conditions on the ground, and they can assist people to enter the health system. They can also assist people to live healthier, and because they know better than I know what it's like to live in that community, so they enable people to live as healthy as possible within the environment that they are.
Okay, you've worked in the field of HIV/AIDS related matters for more than 30 years now. Do you see the change in people? Why are we still seeing the stigma in people?
I've been in HIV before they even knew what it was, and we've made tremendous progress. There are, particularly in South Africa, we've got the biggest treatment program in the world, which largely South Africans are funding through their tax base. But the epidemic is getting to a point of maturity where people think there's treatment and we don't have to worry. It happens in every epidemic, and this is why this conference is so important for us to take stock, to see where we are exactly and where our shortfalls are. One of the shortfall areas is in adolescence. That is where the epidemic is bubbling. And I'm really pleased that the Department of Basic Education has realized that the teenage pregnancy rates in our schools tell us two things. School kids are having sex, and school kids are having unprotected sex. And they need to understand how they can express their sexuality safely. So it's a big focus of the conference, adolescent health. And secondly, the other thing is, you can't describe South Africa in one blanket. The epidemic is very localized, and we need to get a better idea of the local dynamics, and so that the interventions can be better targeted.
Okay, thanks a lot. That's Mr. Andrew Robinson, all the way from the Northwest. He's going to head some of the plenary sessions. There are so many other topics that are here currently taking place. The key word from here is that they are still encouraging the basics of HIV/AIDS management. You have to stick with the basics of ABC, of which is abstaining from sex or be faithful to your partner, as well as using condoms. That's what the man here is saying. The Professor Robinson is saying that people have to make sure that they do not stigmatize people who have already disclosed their HIV status. It's back to you in the studio playing.
Yeah, look, Vusi, a lot of progress, no doubt, has been made, especially here in South Africa, with regards to mother-to-child transmission, when we look at our ARV program as well. So progress noted indeed, but as you know, some of the numbers you were throwing at us in terms of over 31 million people globally infected with HIV, reportedly here in South Africa, over 7 million, and that back in 2017, the number of 270,000 new infections were recorded. So As we were saying and talking yesterday, no room for complacency. In terms, Vusi, of the 90-90-90 target set by the UN, the target is coming up, I think it's next year in 2020. What sort of information have you received with regards to that? What sort of progress has been made?
Yes, there was a speaker from the UN who was saying that as UN, they've set up a very ambitious global target of decreasing or reducing HIV/AIDS by in 2030 and 2030, saying that every year from now they'll have to ensure that there's a reduction of less than 500,000 people who are HIV positive each year, because we are told that more than 270 people are infected. That's a yearly or per annum. She was saying that all people have to stick to the basics of HIV/AIDS management to ensure that they do not get infected or affected by this disease. Well, there are quite a number of issues that are spoken here during the day. We anticipate that the march will also take place being led by NAPWA here at the Durban ICC. It will start at the Durban Central all the way to the very center, whereby we are also expecting that march to end here at the Durban ICC Center. Yes, Ben, we did mention that KwaZulu-Natal, as I alluded earlier on, that is regarded as the epicenter of HIV and AIDS, and also about 1.3 million people who are circumcised. That's a program led by KwaZulu-Natal Premier as well as the MEC of Health here in KwaZulu-Natal, Nomagugu Smelane, and the Premier as well, saying that about 1.2 people already in KwaZulu-Natal are on medication or are on ARV treatment.
Vusi, thank you very much indeed for your reporting. We'll try to catch up with you a little later on with regards to this conference, the 9th South African AIDS Conference happening in Durban. Vusi Kumalo, they are man on the ground.